Thank you, Hugh. Thank you, Randy. I'm so impressed by our recent class. They're real game changers. I'm excited to see what they do next. It's now my honor to present the Jim Bernstein Community Health Leadership Award. Unfortunately, Dr. Pullen Smith can't be with us here tonight. She pre-recorded some remarks. Dr. Pullen Smith's been a leader in North Carolina for more than 35 years. She oversaw important change in North Carolina, making our state government more equitable and accessible for everyone. From serving as the founding director of the North Carolina Office of Minority Health and Health Disparities to developing a statewide cultural diversity training initiative and establishing a community health ambassador program and conducting the first Native American tribal health needs assessment, she's left a mark on our state. Dr. Pullen Smith is so deserving of this award, and this is an award we give each year to a leader who's been deeply invested in their community and region throughout their career. Dr. Pullen Smith, if you're watching, congratulations.
Good evening, everyone. I'm sorry I can't be there with you. We had already made travel plans out of the country, but just know that I am so humbled and honored to receive this award. So I thank you to the board for even recognizing my career and honoring me with this Career Achievement Award. And I see it as a way of honoring Jim Bernstein and his legacy. I definitely enjoyed working with Jim. I considered Jim a friend. One interesting experience I had in my journey as the director of the Office of Minority Health and Health Disparities, with the changing in administration, the new governor coming in, I never knew exactly where we would land. And so I remember the year when they were trying to figure out, the leaders were trying to figure out, well, where should the Office of Minority Health go? I was in public health at that time, but then the decision was, oh, the Office of Minority Health belongs with the Office of Rural Health. Wow. One of the best decisions that they could ever make, because then I got to work arm in arm with Jim and got to spend more time and really got to learn how he approached the system. We were working in the same system, but somehow he seemed to figure out a lot more things. So he would let me rant and rave, and then he would smile and he'll say, okay, Barbara, what we gonna do? And that's what I loved about him. He was about solutions. He was about, let's figure it out. It's not fair, it's not right, but let's figure out a way to make sure that the people get what they need, because that was always his focus, was always about serving the community. So I value that, and I will always value that. I like to say about Jim as I reflect that Jim was the guy who really embraced and practiced diversity, equity, and inclusion long before that was a thing. And so in just my dealings with Jim, I always felt seen and heard and respected, and that says a lot. We shared a lot of common principles about how you deal with communities, underserved communities especially, and so we believed that, you know, healthcare is a right and not a privilege. We both worked in communities to make sure that we helped people in the community to learn how to be their own advocates and to be their own spokespersons and to learn how to work the systems so that they could be the leaders in the community. So it's not just community-based work we did. It was literally helping community leaders to lead the efforts and become their own advocates. And so I'm just humbled and honored that the board reflected on my career in public health. I had an amazing run, an amazing journey, and I believe that we actually had some impact in terms of influence in systems and programs and services. But the main thing that we did is we valued people. And the other thing that we did is that we helped people to be their own health advocates. And for that, I'm excited about it. So thank you again for just acknowledging the work in public health. It was an amazing run with some amazing people. And I'm just so grateful that I was a part of that. So thanks for recognizing me.